Dr. Devin Pettit here from Tomball Chiropractic Center. I wanted to talk to you about a new little toy that I got. It's really helped me explain to some of my patients what a disc herniation is now. We hear that a lot in different forms: slip disc, disc protrusion, disc herniation, disc bulge, pinched nerve. But what does that really mean? To my patients, we try to do a great job of educating them. When a little toy like this comes along, that just makes it so much easier. Let me show you if I could. So if you look here, this is the bones, you got the disc. It's a nice squishy, kind of like a lobster meat, if you will. You got the nerves coming down here. This is the spinal cord going through the spinal canal. These are the joints right here, both sides. But what's really interesting, when you move this nerve, that's how it's done, by the way. You just move nerves out of the way. What you'll notice is that when you put pressure there, you'll notice that literally some jelly comes out of the donut, right? We refer to this disc in here as the jelly donut. You've got this dense white cartilage surrounding the nucleus of the disc. We call that, we kind of refer to it like a jelly donut. It's not exactly like that, I hope you understand, but it is pretty cool that when you see a disc really herniate, the jelly comes out and it presses on the nerves that are going down, and boom, now you got nerve pain going down your leg, you got nerve pain going down your arm. And that's what's really happening. A lot of my patients come in and they've been told somewhere else that, or they've read on the internet, now they think that bones are literally crashing down and pinching, but that's not what happens. The majority of the time it's a soft tissue problem. So I hope that helps to explain some stuff for you. Now again, I'd love to get into, I don't want to do it on a video necessarily, but I'd love to get into the treatment options for this. It's not always a surgical issue. There are options out there that are non-surgical. You've got chiropractic, physical therapy. We do a lot of spinal traction, decompression. You may have heard of that in our office to help literally, pull it apart and kind of open up. If you notice it, you just kind of open up the space in there, try to unpinch the nerve. In our office, we also have a medical doctor who prescribes pain medication if necessary, does injections. These are some of the benefits of going to a multidisciplinary kind of practice like we run. But we try to keep it conservative. I'll do whatever is necessary to keep somebody out of surgery. Sometimes surgery is required. We just like to make sure that you've exhausted all your conservative options before you get to that point. If you have any questions, feel free to give us a call. Get on our website. Our number is 281-351-7272. Our website is tomballchiro.com. There's some interesting stuff on there. It's not complete yet, but if you have any questions, I'd love to sit down and talk to you about this. If you have questions that are not answered here, okay? Again, I'm Devin Pettit, Tomball Chiropractic Center. I look forward to